People who wear their mask under their nose, why? Question mark. How else are you supposed to smell that sweet, sweet Rona? A Rona. Everyone at my work does this except for me. They say it's because you can't spread or catch corona through your nose. I hate working there. Yeah, a bunch of people at my work do this 100% of the time. And everyone else just wears theirs properly 100% of the time. Also, people pulling down masks to talk. What's the fucking point? I saw a woman in the store pull down her mask to cough without covering her mouth and then pull the mask back on. I've never wanted to slap somebody more in my entire life. My condolences. Nobody knows. I have to wear a mask at work for 8+ hours a day with no break. I tend to pull it down under my nose when I'm not near people for a few seconds or minutes whenever I can. It's the same feeling as when you're running and briefly walk for a moment to catch your breath. Doesn't make starting again any easier, but would be much more difficult without it. Edit. I work in a lab testing for and studying the virus, so we have a large amount of data on the ability of SARS-CoV-2 to survive, what it can survive on and for how long. I am not overlooking its ability to be aerosolized or potentially contaminate the front of a mask. If I were close to my coworkers, I wear a new N95 mask each day. Adjusting the ear loops would impact its ability to sit on the face correctly. The masks have very specific sizes and have to fit firmly against your face. All the men in our lab who usually wear a beard have had to shave for the most effective use of the mask. We have to maintain 2 meters apart at all times. It is only when I am not even within eyesight of them that I will adjust the mask to breath. Also, I use clean gloves if I'm ever adjusting it so as not to contaminate where I'm touching. We have mandatory swab-based testing twice a week and antibody testing once a week. So we know all staff members have maintained a negative status. Please do not overlook the potential risk of pulling the mask down. If your hands are not gloved, disinfected, your mask is not new, and or there are people of unknown infection status that have been or are within 2 meters of you. This is what I do too. I'm very claustrophobic, and breathing in warm air for too long can start to trigger a panic attack. So I really have to take a good, fresh breath every few minutes. Most likely, they're only wearing it at all because they're being required to, or because they've been told they should. They don't actually care about the virus. I went to my local Wally World and one person was putting pastry items away with the mask pulled beneath her chin. Like, what even is the point? To cover that neck beard. I think it's probably that in some cases they are forced to wear a mask but they don't want to or can't breathe well with it on, so they do that. I work in healthcare. Us staff and our patients are mandated to wear masks, which means we wear them properly. Some reasons for wearing your mask improperly are also related to medical issues. Extreme shortness of breath, severe asthma, etc. However, there are several staff members where I work, all of them older, who are resentful about mask policies, Rona deniers, which baffles me. We treat patients fearful, which translates to angry. They all do stupid shit when wearing masks, such as pulling it down to talk and touching the front. I get it, Karen. The world revolves around you, but for once, it just doesn't. I have 2 cousins with cystic fibrosis. Their lungs are constantly riddled with mucus, bringing their lung function well below the average person. Their oxygen intake is extremely lower than the average person when it's at its worst due to this. They are extremely vulnerable to any illness that has to do with the lungs. Because they are immunocompromised, they have to wear face masks a lot, and anytime they have their yearly hospital stays. I have watched them wear face masks since they could walk. If my fucking cousins can do it with a chronic lung disease without complaint, so can you. Glasses get fogged up by your breath when you wear a mask, which makes it hard to see. It's important to wear close-fitting masks that fully seal and cover the nose and mouth to avoid this problem, monsieur. However, A lot of folks only have access to cheap mass-produced masks that don't fit very snugly. So they're operating under the assumption of this is better than nothing. And at least I can see clearly. Surprised I had to go this far down to see this one. If the mask doesn't fit right, it fogs glasses. Though I tend to push mine up when this happens because it means my beard caught it and dragged it down a bit. Same reason I wear my pants below my junk. Why you know what, never mind. Because you can only breathe the Rona in through your mouth, duh. Your nose brings in different oxygen that is Rona-free. Trust me, I'm a doctor and scientist. It's on the internet, so it must be true. Because it's 92 degrees with 90% humidity and my work is all outside. It's like wearing a scarf in midsummer. Thank you for being the only person giving an honest answer from a first-person perspective and not a joke or speculation. Over a prolonged period, and depending on the weather, it can get sweaty under there. So maybe they are just trying to air it out a little. Honestly, at that point they would be better off just tossing the mask, giving their face a wipe and putting a new mask on. It kind of defeats the purpose if you're touching and repositioning your mask. Masks are intended to reduce the spread of germs from the wearer. Assume non-N95, P95, etc. If you are talking and wearing the mask over your mouth, you are still helping, just not as much. Wear it like that during physical activity. And if someone comes near, pull it up. That way you can breathe while jogging. It's however dangerous to touch the front of your mask. You should never touch the outside nor inside of it. Not even to adjust it. Only the strings are safe to touch if you wash your hands afterwards. This is because the virus can survive on the outside of the mask. And touching that is enough to get you sick. I'm too tired of people who just don't know that or wear their masks like idiots. AKA, not, or incorrect. I've been working in the hospital as an extra cleaner, disinfecting COVID departments, surgery rooms and TBC rooms. People really underestimate how bad this is and how easily you can get it. One patient left the ICU after 3 months, and I lost 12 coworkers. So, in short, wear your mask the right way. Protect yourself and others. And do not touch it when putting it on or taking it off. And never touch it to adjust it. Greater than it's however dangerous to touch the front of your mask. You should never touch the outside nor inside of it. Not even to adjust it. Only the strings are safe to touch if you wash your hands afterwards. Well, fuck lol, adjusting my mask has become my new nervous habit. I thought it wasn't mandatory for people exercising. I have glasses and it figs the fuck out of them, so unless I'm near someone I'll have my mask below my nose. Saw someone today wearing a mask on just their chin. My favorite is when people pull their mask down to talk to someone. Think of how stupid the average person is. And realize half of them are stupider than that. George Carlin. My son does it and I can't do much because he's 3. I'm just glad he puts it on and lets me fix it every so often. Good job just getting him to wear it. I try to compliment kids I see with masks to help parents out. It was funny. I was at work today and I get into an elevator. And this family with a grandma, the mom, and a 5-year-old came in. The grandma was wearing the mask just below her nose. The mom had it just on her chin. And the 5-year-old was the only one wearing it properly. How is it that a 5-year-old knows how to wear a mask properly, but not their mom or grandma? Actually, while this does seem counterproductive, upon further reflection, the whole point of a mask is to block you from projecting the virus out of your mouth. Yes, some virus will come out of your nose, but it is far less moist and does not project out in anywhere near the same concentration as from your mouth. You should wear the mask properly, but I will take a nose-exposed mask wearer over no mask. When you shed the virus, you shed it from your lungs, not your mouth. It's not coming from your mouth. Your nose isn't going to absorb the virus like a filter. You're not projecting any less of the virus since you're exhaling the same volume of air from the Same source. The air coming up from the rest of your respiratory system is plenty moist before hitting the mouth. On a cold day, do you not see the breath coming from your nose too? That this is upvoted so much is scary. It's about force. Assuming people aren't stupid, dickish enough to sneeze or cough uncovered. We're talking normal exhalation flow from a nose, and forcefully exhaled air from a mouth because of talking. Especially when we gotta yell due to spacing and plexiglass. The mouth air is getting expelled with way more force than ordinary breathing. More force equals more wetness getting sprayed farther. I am not saying these jackasses are right to leave their noses uncovered, and I myself mask properly, but I do think mouths are the source of much more mucus droplets than noses are. There is way more mucus flying out your nose than you realize. I work in landscaping. We're required to wear masks while at work, but usually our crews split up at job sites, and we're never really working near each other. It's also been fucking hot lately, so usually I pull my mask down a bit so I can breathe easier. I just pull it down below my nose. Sometimes if it's really hot then it'll go below my chin, but I never take it off completely. If I have to regroup with my coworkers, or the homeowner comes out to talk, or even just if someone walks by when I'm working near the sidewalk, then I always pull the mask back up over my nose until we go our separate ways again. PSA: if anyone says they won't wear a mask correctly because their glasses fog up, they're full of bullshit. I'm a dentist, so I wear masks almost all day every day, and I have 0 instances of foggy glasses. I don't care what kind of mask it is. You can make it work. Optimally, you want the air passing through the mask. If it is foggy up your glasses, it is not doing that. If you are having this problem, then wear masks with metal nose bits. Put the mask on. Adjust the metal to your nose. Viola: no more foggy glasses. If you are still getting foggy glasses, do the ear loop twist. Put the mask on your face and twist the ear loops before putting them on your ears. This will have your breath vent more to the side than upwards. Not optimal, but still better than no mask. Obviously there are extenuating circumstances if you work in a steam room or whatever, but I am talking mostly about the people who aren't wearing one to the grocery store because of this BS excuse. PSA: for someone with a medical degree, it's weird that you think just because it doesn't affect you means it doesn't affect other people. Could you explain this in more detail? I press the metal wire against my nose face, and my glasses still fog up. It seems difficult to avoid air venting out through the top. I still wear the mask over my mouth and nose, even if I get some glasses fog. Pinch the wire on either side of your nose while pressing down. Then, while holding the wire around your nose in place, press down on the ends of the wire against your cheeks. Nice assumptions. I'd love to see any of your anti-fog tips hold up when one is constantly moving, breathing heavily, and frequently moving between the outdoors in a heavily air-conditioned building. Under the right conditions, I can fog up my glasses without a mask just by sweating. They're only wearing a mask because they have to. They don't actually care if they get you sick. I hate people that complain about wearing these masks for a couple minutes whenever they want to go out and they don't take this corona stuff seriously. My dad has taken me to work for his company, and from 8 to 5 I have to wear those industrial masks while I load bricks into trucks, demolish things in attics, and remove insulation all throughout the summer. I'm 15 fucking years old, and I know how hard it is to breathe while you're slaving your ass off all day, so it pisses me off when people say it's hard to breathe in while they use those thin, cheap masks. My coworker wears her mask correctly, but every time she tries to talk, her chin pulls the mask down below her nose. I haven't had this problem, but maybe her mask is too loose. I've had this problem several times a day, and I work in a place where I can't always fix it right away. I feel just as judged as when I need to cough or sneeze normally. I get OP's point, but sometimes you can't help it. PTSD survivor of a murder attempt. You're lucky I'm even trying. Having anything on my face or neck sends me into catatonic panicking. I am doing the best I can. Karen STFU. Thank you so much for watching and have a good day.